Good morning, everybody. Welcome to the Investment Strategy Committee meeting for November 26th. The voting members of this committees are myself, Councillor Bosch, Councillor Blackmore, and of course, Mayor Clayton. Could I get a motion to adopt the agenda? Councillor Bosch, discussion or debate? Don't see any. I'll call that to question. That motion carries. We don't have any delegations, so I'll move on to reports. And first of all, the service area update, Acting Chief Trent.
Thank you, Chair Bressie. So a number of updates here today. So for Invest Grande Prairie, Invest Grande Prairie was able to tour Invest Alberta around the region with the MD and the county, highlighting local investment opportunities here and identifying our opportunities to collaborate further with Invest Alberta. Invest Grande Prairie, alongside members of CLT, met with Ovintin to share ongoing efforts and initiatives. Big thank you to the Ovintin team for the insightful tour and for sharing updates on their regional efforts. Destination Canada's Northern Sky Corridor development is moving forward with Explore Edmonton meetings and a tour with consultants in Grande Prairie on Sunday, November 24th, or took place on Sunday, November 24th. For the rural renewal stream, there are currently 365 eligible and approved positions. Year to date, 305 candidate endorsements have been approved, 859 since the start of the program. 10 new employers were approved at the November 21st Community Partnership meeting. A recent update from AHS shows that 26 new physicians have started in Grande Prairie between January 1st and November 1st, with an additional with an additional 7 that have accepted and have not yet started. Moving on to legislative and executive services, the deadline for public members to apply to join a city board, committee, or commission is this Friday, November 29th. We've been very happy with the number of applications that have come in to date, but there still is a little bit more time to submit. There are numerous bylaw and policies currently being worked on, and the annual renewal process for insurance is wrapping up. Contracts and agreements continue to flow. Final arrangements have been made for the city's annual destruction activity, which happens in December as part of the records management process. So there is elections 2025 preparations continue, and the as we get closer towards the January 2nd opening for nominations. Also in Legend XX Services, we have the Interfaith Breakfast that's coming forward this week on Thursday morning, and so ticket sales have continued to be. We decided to keep those open for another day. So if anybody would like to attend or knows anybody that would like to attend for the Interfaith Breakfast, there are still some tickets available. In corporate communications and marketing, various announcements have been issued, including parking bans for the snow removal. The Tennille Towns Way was unveiled, and there was comms regarding the 2025 budget and ongoing promotions for the holiday promotions at Eastlink Centre. Marketing promotions continue for advertising in the 2025 Grande Prairie Guide, the Christmas tree light up, Eastlink Centre member sale, board and committee recruitment, the free and the CDN controls free skate. With that concludes my report.
Thank you, Chief Tarrant. I'm not seeing any. Oh, Councillor Blackmore, in my blind spot.
In your blind spot. Chief Tarrant, you mentioned Northern Skies. Can you tell me a little bit more what that is?
At this point, I don't have full details, but I'll be able to make sure that we get further details to Council.
Okay, maybe just email them to us. Thanks.
I can update a little bit. So through initiatives of Travel Alberta, working with Explore Edmonton, they're hoping to create tourism packages that start in Edmonton and drive people to Northern Alberta to experience things like Northern Lights and Northern Skies, big open skies. None of the communities around us qualify to be dark skies like Jasper, but they're exploring what the opportunities are to see if they can create some tourism packages out of them. Yep.
Great, thank you for that information. I think we're good to move on, so I'll also hand it over to Acting Chief Tarrant to introduce our strategic priorities report.
Thank you, Chair Bressie. I will direct it to Ms. Bilodeau, who will be able to take the report and give an information update on the strategic priorities update.
Perfect. Well, good morning, and thank you, Chair Bressie. The 2022 to 2025 Q3 2024 Progress Report provides a detailed update on project statuses, completion percentages, and timelines of the projects and initiatives set out by Council at the start of their term. As you're reading the report, keep in mind that the information is accurate as of September 31st. New information arising since that time, such as during budget deliberations, will be captured and reported on within the Q4 report. I will provide a correction that in the administrative report, there were 4 projects listed as being completed in Q3. However, the attraction or retention of healthcare professional strategy had been concluded at the end of Q2. So the remaining 3 projects or initiatives that were completed are the Polytechnical Liaison Training Needs Gap, which has resulted in formalized and ongoing collaboration with NWP through the Work Northwest Partnership, the Coordinated System of Care Action Plan, which saw the referral pathways being updated for coordinated access for housing and homelessness, and the Bear Creek Slope Stability Study, which helps provide guidance on the safe development zones adjacent to Bear River. Administration continues to work towards completing the remaining projects and initiatives and will continue to report back to committee following the end of each quarter. And once the Q3 progress report is approved by Council, it will be made available on the city's website for public access. And with that, I'm open to any questions you might have.
Thank you for the report. Are there any questions? Councillor Blackmore.
I'm really impressed with how fast or how well administration has accommodated the strategies laid out by Council. I'm just curious if there's any particular area where you've kind of hit a roadblock or you're worried that you're not going to be as successful as you'd hope to be.
Thank you, Chair Bressie.
Maybe I'll hand that over to CEO Burke.
Not at this time. As you'll see in Q4, there were a number of items, though, that would have required budget to move further. And following deliberations, there wasn't budget provided to advance those much further. So those would probably be the ones that just a recalibration of Council's priorities that we won't be moving on, but we've had that signal from Council not to. So those will be the only ones that come to mind.
Okay, thank you.
Thank you. Any other questions? Somebody willing to recommend that Council accept this? Councillor Blackmore.
I would recommend that I would ask the committee to recommend Council to receive this report for information.
Don't see any discussion or debate, so I'll call that to question. Motion carries. Thanks, Ms. Bilodeau, for the report. We appreciate it. I'll hand it over to Acting Chief Tarrant to introduce our healthcare strategy report.
Thank you, Chair Bressie. The health strategy report here is came from Council's strategic priorities, identifying that the recruitment and retention of healthcare professionals was a key priority for this Council. Last year, Council funded $50,000 towards a number of initiatives, and so there's been a number of initiatives that have gone forward in this past year. We continue to expand and build on that strategy, and recently Council approved an additional $100,000 for next year's budget that will go towards these initiatives, and this is the strategy that will guide where those dollars will flow. So with that, I will turn it over to Ms. Pinnock, who will give the more details.
Please go ahead, Ms. Pinnock.
Thank you, and good morning, committee. So just assuming that committee has read the report, I'll just briefly touch on a couple of the key initiatives that are being brought forward today. Council approved the strategy and action plan back in June, and as Interim Chief Tarrant had mentioned, $50,000 was allocated towards this project in the 2024 capital budget. So what you have before you in the report are the following: a new incentive policy for family physicians, The program is structured to both attract and retain physicians, providing not only an incentive for relocating to the region and practicing in the city, but an opportunity to get physicians and their families connected into the community and our many amenities and programs. The program includes memberships and vouchers to participate in local activities and events, a travel voucher, and a small cash incentive with a signed 3-year return service contract. Administration is recommending allocating $30,000 from the 2024 healthcare capital account and an additional $30,000 from the 2025 healthcare strategy capital account once the 2025 budget is formally adopted next month. The program would launch on January 1st, 2025, and any physicians who relocate on or after the date that the policy is approved by Council would be eligible to apply. The second is the Healthcare Taskforce terms of reference. It was identified in the action plan under information that the city would benefit from formalizing a core group within the city of elected officials and administration to support information sharing and ensure the strategy is aligned and progressing with Council's greater strategic advocacy priorities around healthcare. The third thing in the report is the Ambassador Program. This is an important action to support sustainability around our efforts to both welcome and integrate new healthcare professionals into the community. The opportunity to become an ambassador will be focused on specific sectors to start, including real estate, banking, insurance, education, and community programming, and will be expanded as needed. Ambassadors will be volunteer positions and will support where appropriate during site visits, post-relocation integration, and follow-up. Ambassadors will be individuals who can help sell our community's attributes and help ensure that in the first year, in particular, our new healthcare providers are feeling supported and welcomed. I'd also like to draw committee's attention to the alternative section into the report, where we've identified 3 additional considerations, 2 that I'll just touch on briefly. An opportunity to potentially partner with the County of Grande Prairie and expand the program across both municipalities if there's interest, and the potential to add medical clinics to the list of eligible projects under the recently reopened municipal fee rebate program through Invest Grande Prairie. And with that, I'm happy to address any additional questions that committee may have.
Thank you for the report. Are there any questions? Councillor Bosch.
Thank you, Chair Bressie. Just a question in regards to this ambassador program. Have you had any anybody step up or discuss that they want to be a part of this to date, or is it just, when's it rolling out?
Through the chair, it will be rolling out by January 1.
Okay, thank you.
Councillor Blackmore.
And Ms. Pinnock, do we have an application process in mind, or if people are curious now, can they, how would they get more information?
Through the chair, the plan will be to do a social media campaign through Invest Grande Prairie and to have it be an informal application process where the team would connect with interested individuals. We'd have a short matrix that we would follow, and individuals would be selected based on that discussion.
And if someone's interested in being an ambassador, what's that time commitment going to look like for them?
Through the chair, it really depends. We have asked for a minimum of a 1-year commitment in the outlined documents, just to ensure that we have some continuity throughout that year for somebody who's interested. But it's really going to depend on how much time they are willing to commit. The hope would be at least 3 to 5 hours throughout the course of the year to support on some of the site visits potentially, and to do some follow-up coffees and connect with the new healthcare providers.
Thank you.
Or any other, Mayor Clayton?
Thanks, Chair Bressie. Just a question in regards to the opportunities moving forward with our municipal partners. I know the county and as well as other municipalities in the region are also trying to attract and retain healthcare workers. In the future, is there an opportunity to expand this program and have future conversations? Will we revisit, or maybe you can expand a bit on that?
Thank you, through the chair. We have had some preliminary conversations with our economic development colleagues at the county. There is certainly interest in expanding the program to include the county area, particularly the county and potentially the small urbans that are within the county's area, partly because marketing a program jointly also supports us through the Work Northwest partnership in talking about one comprehensive program. So if council is interested in that, if this passes, they would know what our program looks like. We have shared some preliminary information, and then there would be opportunities to go and have some conversations about specifics around joining programs.
Great, thanks.
Councillor Blackmore.
Just a follow-up question about that. I see on your chart Appendix A physician incentive comparators. It says the county of Grande Prairie is 10,000 K county and then 10,000 city. I don't really understand what that means.
Thank you, through the chair. The county currently has a program where they offer $10,000 for physicians that are that apply to their program and are located within the county, and physicians that are located within the city, they offer a $5,000 incentive for a 3-year return service contract. So they currently allow city physicians to apply to their program, and they were subscribed, I believe, in 2023, and up to the total that they have in that pot, I believe they have $20,000 as part of that program.
Thank you. So they already are really working with us, even though we haven't really acknowledged that, right?
Through the chair, yes, their program has been ongoing for a couple of years now, and it's a straight cash incentive.
Okay, thank you.
Not seeing anybody else with questions. Is anybody willing to do business? Councillor Blackmore?
I would move that committee recommend council approve the new family physician attraction and retention incentives policy with a launch date of January 1st, 2025, and allocate $30,000 from the 2024 healthcare capital project to this program, and 2, approve the healthcare attraction and retention task force terms of reference as presented, and 3, approve the ambassador program as presented.
Any conversation or debate? Don't see any, so let's call that to question. Motion carries. Thank you, Ms. Pinnick, and your team for all the work you're doing on this. We appreciate it. And again, I'll hand over to Acting Chief Trent to introduce this Council Parental Leave Report.
Thank you, Chair Bressie. This came out of a motion of council previously, requesting additional information on what other municipalities are looking at or doing in terms of parental leave and bereavement for councillors. And so Ms. Hansen has done a jurisdictional scan, and she'll give some information on that right now.
Ms. Hansen.
Thank you, through the chair. So the report that is before you provides information on the jurisdictional scan that was conducted and providing council and committee for some information for your consideration. So under the Municipal Government Act, there are requirements that if a council wishes to have parental leave benefits, that a bylaw is required. So section 144.1 on page 1 of the report outlines the parameters of those, which includes ensuring that the bylaw has considerations around respecting the length of leave and what those terms would be if you were looking to have parental leave. And also included in that is a requirement to address how the municipality will continue to represent their community members during the period of leave. In the report as well, the jurisdiction scan shows a number of communities that were researched and to look at how many of them had it and what the terms were, and that's provided for you. That also includes the comparative mid-sized cities that we would typically look at for a number of different purposes. Summary of those, it does vary from municipality to municipality. As you see in the chart provided to you, a number of mid-sized cities do not have parental leave benefits and others do. And so with that, it ranges from that maximum of 26 weeks, some of them being up to 16 weeks. And again, it really does vary, and so that information is provided. In addition, the remuneration rates differ. And so there's several different things to take into consideration when reviewing this. And so the second question, I guess, that was posed was around bereavement leave. And there also was some scanning done to look at what other municipalities are doing in that respect. And we found no bylaws or policies specific to bereavement leave. In the city's Code of Conduct bylaw, bereavement leave and medical leave are already addressed in those, and that's provided for you for information as well. Happy to answer any questions that you may have.
Thank you. Are there any questions for committee? One that I've got is, I'd sure love to see us do this. I don't know if my colleagues agree or not, but I'd love to see us do this. If this was something that council wanted to implement, would the recommendation be to ask administration to make amendments to policy 100 or to do a separate policy for parental leave for council?
Thank you for the question through to the chair. The MGA requires a bylaw be drafted and approved if you are wanting to consider a bereavement leave option. And so if you are wanting to do that, then the direction would be to draft a bylaw and bring back for council consideration.
Okay. Councillor Blackmore?
That would be the case for both parental leave and bereavement, or is parental leave can be covered in our I'm not, like you said bereavement leave, but you didn't say parental leave. So I'm wondering if there's a difference.
Thank you. Thank you for the question, Councillor. Through the chair to Councillor Blackmore, the requirement is for parental leave requires a bylaw in order for council to have that benefit put in place. Bereavement leave right now is addressed in the Code of Conduct bylaw. So, yeah, 2 different items, if that helps.
So I can't make motions here, and I don't know what the appetite of the committee is. I'd personally love to make this happen. I know for me, looking at not just the composition of council, but also the candidates that ran last time, we really do have an issue, I think, where a selection, I don't believe we had a single candidate under the median age who ran for council. I was one of the youngest candidates, and I was older than the median age of council, and I think that's a real issue. And consistently, when I talk to people in the community about why aren't you running for council, you'd be great, I hear issues. The issue always does come down to remuneration, where they recognize that they've got opportunities and other employment that they don't have here. And I think one of those opportunities for younger people is they actually can't have children and spend time with the baby at home, or spend time recovering if they need to recover from pregnancy. And that's something that they probably actually do have the freedom to. I know we work well as a team when we would make that happen for a councillor, but I know that's hard for somebody outside of this to believe, hey, I can make it work. And who knows who their colleagues are going to be next term. Maybe their colleagues next term wouldn't be able to make that work. So I know on this council we could make it work, but I think it's really important for us to signal to the community, hey, if you're a young person and you want to run for office, but you also want to have kids in the next few years, that's something that's totally okay, and that this community and that this council would support. So for those reasons, I'm hoping that we'll do some work on this, but I don't know if anybody else has appetite. Councillor Bosch.
I have a question in regards to the councillor role. It's considered a part-time role. Is there parental leave with part-time jobs typically? Do we know that?
Thank you for the question. Through the chair to Councillor Bosch, a number of the municipalities that we scanned have part-time councillors, and so it varies. I would say of the list, then the metro centres, they are likely to be part-time councillors. It would be up to City of Grande Prairie Council to determine what those terms are, and how to address the accountability piece back to the community when they're on a leave.
Okay, thank you.
Well, I'm not seeing anybody scrambling for their microphones, so I think I might be alone on this on committee, although there might be a notice of motion coming to council in the future if I am alone on this. But we should do some business today, even if it's just to accept this report for information. Councillor Blackmore.
For myself, I think that there's some information missing before I could make a decision. An estimation of costs would be something that I would find valuable and would help me make a decision moving forward. Typically, it is difficult to attract young people to a council. I'm not sure that this would move the needle that much because I think the reasons, there are many other reasons that carry more weight. So I just am not ready to make a motion with the information that we have in front of us. But if it comes forward as a notice of motion at a later time, I guess that would be the information that I would need to have to make a decision.
Mayor Clayton.
Thanks, Chair Bressy. I appreciate Councillor Blackmore's comments, and I appreciate the report, the information's there. I guess what more I was hoping for from administration was a recommendation of what we believe would be based on the scan of the other mid-sized cities. I've seen Sylvan Lake's policy. I've seen a couple of them, and I don't know, other than direct administration to bring back a proposed policy, what the motion would be today. And I don't personally have enough of what I think it should be. So I understand. Yes, I think we should have a policy. I agree with Councillor Bressy on that. I'm just a little bit not sure where we should head next.
Gilbert.
Thanks, Chair Bressy. The request to administration was just to do the scan, not to provide any recommendations or specifics. If there was some interest in further work, we would take that away. But this was as far as council asked us to go. It is up to council to decide to proceed or not. If there were some parameters, if it was the high and low range and to cost that out, we could come back with that information at a subsequent meeting if there was further direction.
Something I would highlight is if we did institute this and a councillor took parental leave, we're paying a council salary anyways. So this would actually be if a councillor took leave and we chose not to pay them at full salary, that would actually be savings for the city. It wouldn't be an increase of cost for the city. It'd be definitely more workload for the rest of council and less representation. But I don't see how there'd be financial costs to this. Councillor Blackmore.
So I will make a motion. I would move that this committee direct administration to bring back a report to a future meeting with some cost parameters and recommendations for possible policies. Bylaw. Okay, bylaw, not strike the word policy.
That's certainly in order. I'm wondering if you might be willing to take a bit of a different direction in terms of what I'm worried about is it's mid-November and we need candidates to know early in the new year what's going on. So I'm worried if we ask for another report and then based on that report we ask for a bylaw that this is going quite far into the new year. And I'm wondering if we might be comfortable with administration bringing a template bylaw. But then within that bylaw, if the bylaw came back and said, hey, we're looking for, bylaw says 16 weeks, but that'd be pretty easy for us to amend to 8 weeks or 24 weeks or whatever we want to do. So I wonder if you might be open to asking for a template bylaw to comes committee for us to talk about and look at.
Yeah, I'm okay with a template bylaw. We have to have some ground of discussion, and that is pretty solid. So I'll look to our city clerk to make that all very nice on the screen so we can vote for it.
Bring back a draft bylaw regarding councillors and parental leave. Right. Awesome, thank you. I appreciate that. Any conversation, debate on this? Okay. Well, again, Councillor Blackmore, I appreciate you putting this motion on the table. Thanks to the committee for working on this. I really appreciate it. Not seeing any discussion or debate, so let's call this to question. That motion carries. Thank you. And our related next report, I'm assuming Ms. Hansen's presenting, but I'll hand it over to Acting Chief Tourette in case there's anything he wants to introduce.
Thank you, Chair Bressy. No, with that, I'll turn it over to Ms. Hansen, who will be able to give the background on the proposed changes.
So thank you, Ms. Hansen.
Thank you. Through the chair. So previously, the Council Remuneration Committee had made recommendations in September to direct administration to to consolidate policy 100 and procedure 100-1. Council did direct administration to bring that back based on that recommendation. And so today before you is the consolidation of council policy 100. So just for a little bit more background, council will see, committee and council will see in the next few weeks 2 council policy 100s coming back to you. Today is all about the consolidation of 100 and procedure 100-1. And that is really to combine the 2 policies together, do some housekeeping around that, and for consistency and clarity. The second policy 100 that will come back to you, and that one would, based on approval of council, if committee wishes to send that forward, that would take effect upon approval, which would be immediate. The second policy 100 that would come back to you is after that, and that one is to deal specifically with the recommendation regarding compensation that was seeing the recommendation for 55% of the mayor's salary being the council member salary. And that one would take effect in October of 2025 after the next election. And for the next term of office. And that is the reason for the two separate policies being brought forward to you. Just so if you see another one coming, that is the reason for that. So for today, though, the consolidation of policy 100 and procedure 100-1 is before you. And really, the main parts of it is to create that consistency, the terms and conditions that ensure they're both aligning, and for ease of administrative management of that policy. With that, there is the draft policy before you and also the markup copy that is also provided for ease of reference for you when you're reviewing the documents. And with that also, the templates have been updated to meet recommendations that were put forward from administration. With that, I would open it up for questions that may be easier on this particular one.
I don't see anybody in the committee, so I'll go to Councillor O'Connor.
Yeah, I'm just looking at a point, even though I'm not on this committee, I'm concerned that there will still be some confusion. I'm just wondering if you don't have either give it a policy 100 and 100-1, a different number after, like 100R revised, or just give it a totally different number. It just seems to me that we're flipping back and forth, and which one are we referring to? So that's my concern.
Ms. Hanson?
Through the chair to Councillor O'Connor, should the committee approve the recommended policy 100 today, and council approve the policy 100, procedure 100-1 ceases to exist. It would be then administration, the recommendation would be for administration to remove that policy, and so there would only be policy 100 at that point. And that would be what would be provided for the public, for council, and for administration to administer.
A couple comments I've got is just a really minor typographical one, but under the mandatory event schedule, Alberta municipalities is abbreviated as AM and would prefer to be abbreviated as AB Munis. And then one other one that I did want to talk about is in terms of the mayor assigning mandatory events, really happy and fine with the process outlined here. That being said, I wonder if we should add some language around the mayor should make effort to give equitable opportunities to all of council for professional development. And just speak that I have zero concerns whatsoever about Mayor Clayton. She's very fair about making sure everybody gets an opportunity and the best person goes to things. She doesn't play favorites, but we're writing this policy for future councils as well. And I know there are cases in the province where mayors don't play fair, where they do reward their favorites and take away opportunities from people that maybe aren't on their side politically. And I know that saying, hey, just give it equitable opportunity, that's kind of a floofy thing. But I don't know how you get more prescriptive than that. But at least if we had a mayor behaving inappropriately, it would give council some teeth to say, hey, you're not being fair about this. You need to give everybody opportunity. So it's language I'm wondering if committee might be interested in adding in here. And again, not because of our current mayor, because of potential future ones. Mayor Clayton?
I'm happy if you had suggested wording to make that motion.
Yeah, I was going to say something like, just the last sentence, adding something like, the mayor will make efforts to provide equitable opportunities for professional development to all members of council.
Yep.
Something like that.
Perfect.
Okay, thank you. I appreciate that.
As a motion, yep.
Wait for that to get an e-scribe.
You all do. That's the point of it.
Yeah, I'm just worried she'll send me everywhere if she's only sending her favorite. And while we're waiting for that, Councillor Bosch has a question.
Thank you. I don't see anywhere in here. What is the rate of mileage that you pay out? Do we know?
The rate of mileage through the chair to Councillor Bosch is based on the provincial rate.
Just curious what that is now. I haven't even heard of what the number is in years, so I have no idea.
Okay. Just a moment. I'm just going to find it here for you. Thank you.
That's okay. You can send it any other time. It's just a curious question.
Thank you. Through the chair. So we do follow, I believe that one's federal rates for mileage claims. So anytime the CRA would update annually, that's the rate you're going to follow.
Okay. Good enough.
Does that represent what you were hoping? Okay, that's good.
That motion carries. Any further discussion or debate on this policy? Yeah. So then are you willing to move it to council?
I move that the committee recommend council approve amendments to policy 100, being the council remuneration and expense reimbursement policy as amended.
Right, that's certainly in order. I'll call that to question. That motion carries. Certainly one of the more awkward things we do, so we appreciate your staff's time making this work for us, so thank you.
Thank you very much.
And then I'll hand it over to Acting Chief Tarrant for the outstanding items list.
Thank you, Chair Barresi. The outstanding items list can remain as it is there right now, obviously with the Policy 100 updates that will be brought to Council next week. And with the parental and bereavement leave, with the motion that was made here today, we will attempt, knowing that we would like to have the information should Council proceed with a new bylaw to candidates as soon as possible. We'll make all attempts to have that to Council, the draft bylaw by the end of the year.
Excellent. Councillor Bosch?
Thank you. I move that committee receive November 26th outstanding items list as presented for information.
Certainly in order. I don't see any discussion or debate, so I'll call that to question. That motion carries, and with that, I will call this meeting adjourned. Thank you, everybody.